Welcome to my channel. During pregnancy, abdominal pain is very common problem. When a woman conceives, various hormonal changes occur in her body. Additionally, as the age of conception increases, the fetus also start growing. From the beginning to the end of pregnancy, pregnant mother often experience abdominal pain at different times. Abdominal pain can also occur due to the change in the size of the uterus. During pregnancy, abdominal pain is often normal, but sometimes it can be due to the complication. So, the question is, how can you understand whether abdominal pain during pregnancy is normal or abnormal? So, in today's video, I will discuss why does abdominal pain occur during pregnancy? Number 2. How do you determine if abdominal pain during pregnancy is normal or abnormal? Number 3. What should I do when experiencing abdominal pain during pregnancy? Number 4. When do you consult a gynecologist? So, let's get started. Causes of abdominal pain during pregnancy. Abdominal pain during pregnancy can occur due to both normal and abnormal reasons. Firstly, let's discuss the natural reason. Number 1. Implantation. During ovulation, when female eggs and male sperm unite, it forms an embryo. This embryo then attaches itself into the inner part of the uterus, known as the endometrium, in a process called implantation. At this time, women may experience mild abdominal pain. Although implantation occurs before a positive pregnancy test, implantation pain may occur just 2 to 3 days before the expected date of menstruation. Therefore, if you experience mild abdominal pain in few days before the expected period, and if the period is missed, it is advisable to take a pregnancy test about 10 days after the missed period. Number 2. Lower back or pelvic pain. Due to pregnancy, the embryo gradually grows inside the uterus after implantation. The expansion of the uterus may cause occasional mild pain, although this pain is usually not noticeable in the first 3 months. This pain typically occurs in the lower part of the abdomen, and resting for a while often helps in elevating it. Number 3. Gas and constipation. Pregnancy triggers various hormonal changes in woman's body, including an increasing progesterone. These hormones can lead to problems such as gas, digestive problem, and bloating. Consequently, abdominal pain or discomfort may occur. Additionally, hormonal changes can sometimes result in constipation. To address these issues, it is recommended to stay well hydrated by drinking 10 to 12 glasses of water daily. Include fiber-rich foods in your diet and consume a mixture of 2 spoons spagula hugs in half glass of water. It can be beneficial for managing constipation. Number 4. Round ligament pain. Look at the picture. The part of resembling a balloon in the picture is the uterus. Within the uterus, the baby grows during pregnancy. To support the uterus, there are 2 ligaments on either side of the uterus called round ligament. When the uterus expands during pregnancy, tension is applied to these round ligaments, causing pregnant mother to feel abdominal pain. This pain is commonly experienced around 5 to 6 months of pregnancy. It can start suddenly but usually subside on its own within a few seconds. Number 5. Braxton Hicks contraction. In the last 3 months of pregnancy, the uterus prepares for delivery. During this time, the uterus undergoes contraction known as Braxton Hicks contraction. As a result, pregnant mother may experience abdominal pain. The pain is not very intense, and there is a sudden feeling of tightness and contraction in the abdomen, and that resolves within a few seconds. The abdomen may feel harder during this contraction. The sensation is somewhat similar to menstrual cramps. Now let's discuss abnormal cause of abdominal pain during pregnancy. Number 1. Miscarriage or abortion. If the fetus is lost or die before the 28 weeks of pregnancy, it is referred to as miscarriage or abortion. Miscarriage can sometimes lead to abdominal pain. However, the key difference between normal abdominal pain and miscarriage is that in the case of miscarriage, number 1, the pain is competitively more intense. Number 2, there might be light bleeding, visible brown discharge or clotting. Number 3, sudden change in pregnancy symptom can occur. If these symptoms accompany abdominal pain, it could be indicative of a miscarriage. In such a case, it is advisable to consult with a gynecologist immediately. Number 2, ectopic pregnancy. In a normal pregnancy, the embryo usually grows within the uterus. However, in some cases, due to the various reasons, the embryo does not grow within uterus but grow outside the uterus. For example, ovary or fallopian tube. It is called ectopic pregnancy. This is a life-threatening condition because in such pregnancies, the fetus cannot survive, and if not managed in time, it poses to serious risks in the mother's life. The symptoms of ectopic pregnancy are typically observed between 4 to 12 weeks of pregnancy. Symptoms may include number 1, intense abdominal pain, number 2, abdominal pain during urination or bowel movement occasionally, number 3, sometimes bleeding, spotting or brown discharge. If any of these symptoms are noticed, immediate consultation with a gynecologist and ultrasound exam are essential to confirm the diagnosis of ectopic pregnancy. Number 3, urine infection. Due to pregnancy, a woman is more susceptible to urine infection. While a urine infection may lead to abdominal pain, in this case, symptoms such as burning sensation during urination, frequent urination, lower abdominal pain and fever may accompany abdominal discomfort. To reduce the symptom of urine infection, it is important to stay well hydrated by drinking enough water. Seeking advice from a gynecologist and taking antibiotic medication can effectively cure the infection. Number 4, abruptio placenta. During pregnancy, the placenta provides essential nutrients to the developing fetus through the umbilical cord. The placenta attaches to the uterine wall, and if for any reason it separates partially or completely from the uterine wall, it is called an abruptio placenta. In such case, intense abdominal pain occurs along with vaginal bleeding. This condition is typically observed after 20 weeks of pregnancy and poses to severe sick of both babies and mother. If symptoms of abruptio placenta are observed, it is crucial to advise immediately medical attention for proper diagnosis and management. Number 5, preeclampsia. Preeclampsia is a condition where blood pressure rises suddenly after the 28 weeks of pregnancy. This can lead to abdominal pain, especially in the upper part of the abdomen. If pregnant women experience symptoms like headache, blurring of vision, and swelling of the hand and feet, if any of these symptoms are noticed, seek immediate consultation with a gynecologist for proper evaluation and management. Number 6, preterm labor or premature birth. Generally, childbirth occurs between 38 to 42 weeks of pregnancy. If someone experiences childbirth before 37 weeks, it's termed to preterm labor or preterm birth. Symptoms of preterm labor including number 1, mild to severe abdominal pain, back pain or pelvic pressure. Number 2, severe contraction may feel like cramping. Number 3, fluid or blood discharge from the vagina. Number 4, water breaking. 5, decreased fetal movement. If someone experiences this symptom before reaching full-term pregnancy, it is advisable to immediate consultation with a gynecologist for proper evaluation and management. Preterm labor requires special care to ensure well-being both mother and the baby. Now let's discuss when do you consult a gynecologist. Number 1, if sudden severe pain occurs in the abdomen. Number 2, if there is vaginal bleeding along with pain. Number 3, if there is excessive clear discharge, blood mixed discharge or foul smelling discharge in the vagina. Number 4, if they experience headache or blurring of vision. Number 5, if the baby's movement is decreased. Number 6, if there is blood in the stool or if there is blood with difficulty in bowel movement. Number 7. If there is burning or pain during urination. Number 8. If there is a fever. Number 9. If there is increased water breaking from the vagina. Number 10. If blood pressure is increases. If you experience any of these symptoms, it is advisable to consult a gynecologist immediately. Otherwise, it may be risky. I hope you will understand. I hope today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to the channel to get health advice, health awareness and reproductive health related all the videos, and remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.